Welcome to this recording of a research proposal by the Neurodiversity Youth Lives research team. To introduce you to the Youth Lives project and this proposal, it was co-created by young people with lived experience of mental health aged 14 to 21 and mental health researchers and clinicians through the Youth Lives project, which stands for Youth Lived Experience of Evidence Synthesis. Youth Lives was funded through the UKRI-funded Citizen Science Collaboration Award and ran from 2021 to 2024. The purpose of this proposal is to share the priorities and ideas of young people with the research community, with a hope that these ideas are taken forward and youth voices embedded in future mental health research. Please feel free to use the ideas presented here to support future research bids. We would just ask that you let the Youth Lives team know and acknowledge the Youth Lives project in any bids and papers published. Additionally, we would strongly recommend the use of participatory approaches with young people in future research inspired by these proposals. And we can share details of your project with the young people involved in Youth Lives if you're interested in working with them. You can get in touch with the Youth Lives team by emailing youthlives-project@york.ac.uk. Now, I'm with the Neurodiversity research team now, and they're going to talk us through their proposal, which is based on what is the mental health of young people awaiting a diagnosis for ADHD, autism, and other neurodevelopmental and neurodiverse conditions. So first of all, could you tell me a bit about the background and significance of this research?
The research addresses a critical gap in understanding the mental health of young people who are awaiting a diagnosis for neurodiverse conditions, such as ADHD and autism. Current research has primarily focused on adult populations or on the experiences of individuals after they have received a formal diagnosis. This study, however, is distinct because it targets the pre-diagnosis period in a younger demographic, a stage that remains significantly underexplored. For many young people, the wait for a diagnosis can be lengthy and fraught with uncertainty, impacting their mental health and well-being. Delays in diagnosis can exacerbate feelings of anxiety, depression, and self-doubt, as young people struggle to understand and articulate their needs without a formal label. This research aims to shed light on the specific mental health challenges faced by those waiting for a diagnosis. Additionally, from a youth perspective, most existing research has focused primarily on male populations, contributing to the stereotype that conditions like autism and ADHD are predominantly boys' disorders. By examining the mental health impact on young people of all genders, this study aims to fill the gender-based research gap, ensuring that underrepresented groups are also included. Furthermore, the research will consider how socioeconomic factors, such as the ability to afford private diagnosis, will influence access to services and mental health outcomes during the waiting period. Ultimately, this study will provide insights into an overlooked group, offering evidence that can inform more equitable and responsive support services for young people awaiting neurodiverse diagnoses.
Thank you. And now could you share the vision for this project?
So the vision of this project is to address the significant mental health challenges faced by young people who await a neurodiversity-related diagnosis, like autism or ADHD, by highlighting the psychological toll of prolonged waiting times. The research focuses on individuals aged from 12 to 25 and aims to provide a comprehensive understanding of how these delays impact mental health and well-being. Through a combination of secondary data analysis, focus groups, and interviews, the study seeks to amplify the voices of young people and their families, shedding light on their experiences and advocating for systemic changes to reduce wait times and improve interim support. Ultimately, the project aspires to contribute to the mental health field by generating evidence that informs policy, promotes fairer diagnostic pathways, and supports the development of better resources for those awaiting diagnosis. By raising awareness and providing actionable recommendations, the research aims to enhance the support available to neurodivergent young people, benefiting not only the individuals directly involved, but also the broader community through improved mental health outcomes.
And so what do we already know about the literature and knowledge in this area?
We conduct a rapid scoping review to explore the extent of the literature on the mental health of young people waiting on or who have not received a neurodiverse diagnosis. Due to the large amount of research in this area, we have limited our review to research relating to autism spectrum disorder and attention deficit hyperactive disorder by including any type of empirical study. We found 3,683 potential relevant records, which were reduced by title and abstract, followed by full-text screening to 450 relevant studies. The results were coded and placed into an evidence gap map, plotting the study focus amongst the outcomes. There were some clear patterns in the literature. Most studies looked at those on the autism pathway, particularly children on the pathway, rather than ADHD. Studies were generally observational or qualitative in nature, even when specifically looking for studies on non-diagnosed individuals. Most research studies were on the reflection of those with diagnosis and their relatives on the process rather than those currently undiagnosed. Most research also looked at the family members' experiences or outcomes, not those of the individual. Of the relatively small amount of research that did look at the mental health as an outcome, only 3 studies looked at the mental health of the individual compared to the 7 that looked at the mental health of their relatives. Drawing upon knowledge from lived experiences, we know that the mental health of young people awaiting a neurodiverse diagnosis, such as ADHD or autism, often declines significantly during the waiting period. The prolonged uncertainty and lack of support can lead to feelings of isolation, anxiety, and frustration. Many describe the experiences as being ignored and put by the wayside, which contributes to the heightened anxiety and a sense of being sidelined by the system. Without a clear diagnosis, those young people may lack validation and access to appropriate accommodation that could otherwise support their well-being. This sense of not being heard or prioritized can make an already difficult situation even more challenging. For many, this emotional strain is compounded by the knowledge that others might be receiving support more quickly, especially those who can afford private diagnosis, creating a sense of inequality and unfairness. Furthermore, delays in diagnosis can obstruct access to crucial resources and support systems. For those struggling with conditions like depression or ADHD, not having a diagnosis can feel invalidating or dismissive of their struggles, leading to the further harm of their mental health. As a result, the waiting period often becomes a distressing experience filled with uncertainty, leaving those young people without the tools and support they need, which ultimately exacerbates their mental health difficulties.
That was brilliant, thank you. And now could you tell me more about the method of this research project?
The proposed methods for this research have been co-written by youth researchers and mental health researchers. These have been separated into work packages as follows. Work Package 1, a synthesis and sharing of knowledge on neurodiversity. Work Package 2, collection and analysis of secondary data. Work Package 3, focus groups and interviews.
And if you could tell me more about Work Package 1, please.
Work Package 1 synthesizes and shares knowledge on neurodiversity. So it aims to synthesize existing knowledge on neurodiversity and disseminate to inform future work packages. The synthesis will include a comprehensive review using both specific diagnostic terms, autism and ADHD, for example, and broader terms like neurodiversity movement or neurodiversity paradigm. The purpose of this review is to provide a clearer understanding of neurodiversity, serving as a foundational reference for subsequent work packages. The review will document definitions and language from various perspectives, like perspectives, individuals with lived experience as well, and address misconceptions around neurodiversity. The search strategy will include academic databases like Scopus and Google Scholar, as well as literature from non-traditional sources, also known as grey literature, like the Bookland Review, research-based reports like white papers, charities, and support organizations. Additional strategies could include using web scraping tools with appropriate permissions to search websites efficiently and employing Google Scholar, Dorking to refine search results. Including non-English literature could provide a broader global perspective on neurodiversity. Translation tools or multilingual researchers could support the inclusion of international studies, ensuring valuable insights from diverse contexts are not overlooked. Citation tracking and scholarly articles could also help identify lesser-known studies that are relevant. The output will be a comprehensive review summarizing what is currently known about neurodiversity and will debunk common misconceptions. This will be shared as a published paper and through accessible creative formats such as videos and infographics for effective community-focused knowledge exchange. The target audience includes young people, schools, policymakers, relevant charities, and professionals in the mental health field.
Now, could you talk me through Work Package 2?
Work Package 2 will focus on collecting and analysing secondary data from mental health organisations and services relevant to young people. This data collection will provide insights into the current status of diagnosis waiting lists for neurodiversity-related conditions. The target age group for this analysis will encompass individuals aged 12 to 25, which allows for a broader understanding of the experiences of both adolescents and young adults seeking diagnoses. This age range captures a period of critical developmental transitions, ensuring that the analysis includes those receiving diagnoses at varying life stages, from early teens through to young adulthood. The primary objective is to gain a clearer understanding of diagnostic waiting times, including the number of requested diagnoses and the duration of waiting periods. The analysis will also investigate how these waiting times differ across specific neurodiversity diagnoses, using categories developed in the literature review conducted in Work Package 1. Additionally, the data will be used to explore the factors influencing waiting times and their effects on mental health outcomes. Data will be gathered through a combination of freedom information requests to the NHS, specifically through the National Autism Programme, and private mental health services, as well as direct collaboration with youth support organisations. Complementary data will be collected through surveys targeting young people who are currently on waiting lists or have recently been diagnosed. The surveys will address a variety of factors, including the average length of time on waiting lists per condition and how the waiting time varies between different diagnoses. The impact of demographic factors. Are there patterns based on age, socioeconomic status, geographic location, or other characteristics such as ethnicity or sexual orientation? The effect of waiting times on mental health. Does a prolonged wait time exacerbate mental health difficulties? And if so, does the impact grow over time? Post-diagnosis mental health changes. Does receiving a diagnosis lead to an improvement in mental health outcomes? The collected data will be synthesized to investigate the following core research questions. What is the average waiting time for each neurodiversity-related diagnosis? What factors contribute to variations in waiting times? What is the impact of longer waiting times on the mental health of young people? Does the duration of waiting affect different demographics disproportionately, as well as geographic differences? Given the complexity and sensitivity of the data involved, Work Package 2 will adopt a longer-term approach, allowing time to build meaningful relationships with service providers and youth organisations. This will not only support more in-depth data collection, but also enable follow-up studies to track changes in mental health post-diagnosis. Building rapport with participants and organisations will be essential to ensure comprehensive and reliable data.
Finally, could you please speak through Work Package 3?
So Work Package 3 aims to collect qualitative data on young people's experiences while on waiting lists for neurodiversity-related diagnosis, using both focus groups and one-on-one interviews. This qualitative research will address gaps identified in Word Package 1 and Word Package 2, and will provide a deeper understanding of the personal and emotional impacts of waiting for a diagnosis. Through these interactions, Word Package 3 will capture the perspectives of not only young people themselves, but also their family members and carers, offering a holistic view of how waiting times affect different stakeholders. Eligible participants will be identified based on the findings from Word Package 1 and Word Package 2, and will include individuals with a range of experiences, including a diversity of socio-economic class and location, as well as young people who have experienced both short and long waiting times before diagnosis, those currently on waiting lists, family members and carers of young people on or recently off the waiting list. Participants will be recruited through a combination of methods, such as engaging with schools, youth groups, and mental health support organizations, as well as targeted outreach through social media platforms. This approach will ensure a diverse representation across age, condition, and geographical location. The structure and frequency of focus groups will be carefully designed to foster in-depth discussions while accommodating the needs of participants. Focus group sessions will likely be held once a month over a period of several months to allow participants time to reflect and to capture changes in their experiences over time. Individual interviews will be scheduled flexibly to suit participants' availability and comfort levels, ensuring that those who prefer one-on-one conversations over group discussions have an opportunity to share their stories. The focus group sessions will explore the following topics: initial experiences of being placed on the waiting list. Questions will be asked like, what were participants' expectations and concerns when they were first referred for a diagnosis? The impact of waiting on mental health. How was waiting for a diagnosis affected their emotional well-being and daily life? Quality of interim support. What types of support, if any, did participants receive while on the waiting list, and was it effective? Perceptions of prioritization. Do participants feel that the criteria for prioritization, things like age, condition severity, and geographical location, are fair and appropriate? Focus groups will also capture demographic information such as participants' age, condition, and location to provide context for understanding differences in waiting list experiences. These insights will complement the qualitative finds from Word Package 2, hoping to identify patterns that might not be visible through statistical data alone. To acknowledge the time and contributions of the participants, financial compensation of £20 per focus group/interview for each participant will be offered.
Note: in this study, we use the term neurodiversity to describe differences in how people's brains function, including conditions like autism, ADHD, and dyslexia, as well as other developmental differences. We recognize that neurodivergency can apply to people even without an official diagnosis, especially given the challenges of obtaining one in the UK. To provide a clear basis for comparison, we will use neurotypicality, a brain that functions within medical and societal norms for cognitive, behavioral, and emotional processing, as a reference point to explore behaviors and traits linked to neurodivergency.
And now could you speak me through the evaluation part of the project?
The primary impact we hope to achieve through this research is to raise awareness of the psychological and emotional toll of prolonged waiting times for neurodiversity-related diagnoses among young people, and to advocate for systemic changes that reduce these wait times. By highlighting the experiences and challenges faced by young people and their families, we aim to inform policymakers, healthcare providers, and support organisations, leading to more effective interim support and potentially shorter waiting periods. A key long-term goal is to see a tangible reduction in waiting times, alongside an improvement in the mental health and well-being of those awaiting diagnoses. To measure whether these changes have been achieved, we propose a follow-up review of waiting times and diagnostic experiences in 5 years' time. This future review would compare waiting times and support systems with the baseline established through our current research to identify any improvements or ongoing challenges. Additionally, we will evaluate impact through increased awareness and engagement, looking for policy shifts, the adoption of recommended practices by service providers, and enhanced support for those currently on waiting lists. If our findings lead to these changes, it would be an indicator that our research has contributed meaningfully to improving the diagnostic experience for neurodivergent young people.
And could you explain to me how you'll communicate your findings?
The findings from this research will be shared with a wide range of stakeholders, including SEND groups, educators, healthcare professionals, and organizations working directly with young people. This includes policymakers, mental health clinicians, and support services, as well as charities like Childline and similar youth-focused organizations. The aim is to ensure that key insights reach those who have the most influence over diagnostic pathways and support for the neurodivergent individuals. Academic sharing will include publishing in peer-reviewed journals to inform professional and clinical practices. To ensure accessibility and engagement with diverse audiences, findings will be shared through various formats, including articles, summary booklets, and visual media such as videos and infographics. By adapting content to suit different audiences, such as youth-friendly materials for younger people and their families, we hope to make the research more impactful and easier to understand. This multi-format approach will allow us to communicate the key messages of the research effectively, ensuring that it resonates with both professionals and those with lived experience.
Thank you. And now could you explain the ethical considerations that you've made through this proposal?
Data will be treated carefully. For interviews, each participant will be assigned a number or initials and responses anonymized to protect personal information. Focus groups will use dynamic consent so that person can choose if their input is anonymized or if they want their name attributed to their comments. Data will not be shared without participants' consent. Participants can ask for the data to be removed at any time during the project and after the project's completion. We will comply with the GDPR and data protection policies. Additionally, we may be interacting with young and vulnerable groups on sensitive topics. We will ensure that people are supported whilst taking part, especially as some may have negative or upsetting experiences. To help mitigate this, we will give warnings at the beginning of interviews and sessions about what we will include.
And then finally, could you talk me through any risks associated with this work and how you might mitigate them?
The following is a table and will be talked through as risk mitigation, etc. Number 1, using biased studies could damage the validity of the outcome, and a bias skew may occur due to the varying level of maturity of different areas and knowledge bases due to differences in funding. We can mitigate this by implementing rigorous inclusion and exclusion criteria to ensure that the studies reviewed are sound methodologically. We could use a diverse team of researchers to review and assess the studies to minimize personal bias. 2, important information may be excluded due to the search strategy. Mitigation. Regularly update and refine the search strategy based on ongoing findings. Utilize multiple databases and sources, including grey literature, and conduct a thorough review of references cited in key studies. 3, using information from charities and organizations that have been criticized by those in the communities. Mitigation. Involve lived experience researchers in discussions based on this information. 4, secondary data may be inaccurate. Mitigation. Use trained facilitators to conduct focus groups and interviews, as well as utilizing audio recordings and transcription for accuracy. Cross-check with multiple researchers. 5, triggering and exclusion through focus groups. Mitigation, inclusive language and recruitment. Use inclusive language and provide clear guidelines for participation. Ensure a supportive environment and offer resources for mental health support. Screen participants for suitability and provide options for opting out if needed. 6, unforeseen changes in policy or practice. Rapid changes in healthcare policies may impact the research relevance or findings. Mitigation. Monitor relevant policy changes throughout the research period and adjust the research focus if necessary. Maintain flexibility in the research design to accommodate evolving circumstances and situations. 7, concerns related to data protection and confidentiality might arise, specifically with sensitive participant information. Mitigation. Implement strict data protection protocols in compliance with GDPR and the Data Protection Act. use anonymization techniques and secure data storage solutions, obtain informed consent from participants outlining data usage and protection methods. 8. Potential ethical concerns related to the study's design or execution could arise, such as distress caused to participants during focus groups or interviews. Mitigation. Conduct an ethical review and obtain approval from relevant ethics committees. Ensure that participants are fully informed about the study's aims and methods, and provide support resources for those who may experience distress.
Thank you so much for talking through your proposal with me. The team that have put this proposal together consists of Youth Lives participants, which are 6 youth co-researchers aged 15 to 23 years old at the start of the project in 2022 from a diverse range of backgrounds and demographics. Additionally, 2 mental health researchers worked with the youth co-researchers to co-produce this work, and 5 members of the core Youth Lives team who have experience across citizen science, mental health, and knowledge mobilization facilitated this process. Youth co-researchers have specific experience of waiting for ADHD and autism diagnoses as a young adult, participation on mental health panels, and personal experience as well as that of friends in a school setting. Finally, I just want to remind you to please feel free to use these ideas presented here to support future research bids. But please do make sure that you let the Youth Lives team know and acknowledge the Youth Lives project in any bids and papers published. We would really strongly recommend the use of participatory approaches with young people in any future research inspired by these proposals. And if you get in touch with us with details of your projects, we can send these to the young people involved in Youth Lives to see if they would be interested in working with you further. You can get in touch with the Youth Lives team by emailing youthlives-project@york.ac.uk or by visiting our website at www.sites.google.com/york.ac.uk/youthlives. Thank you for listening, and please get in touch if you have any questions.